Yesterday, the head of the FDA's tobacco area, which is called the Center for Tobacco Products, the head is Mitch Zeller, announced that the FDA was moving closer towards issuing an edict about menthol in cigarettes. Menthol as a flavoring agent in cigarettes has been present, of course, for many years, and it's a huge market in this country, something close to $30 billion market out of a much huger cigarette market, of course. Afro-Americans prefer to smoke menthols for reasons that are not clear to anybody. 75% of black smokers prefer menthol cigarettes, and including white smokers of menthols, and it involves something like between 10 and 15 million people. So this is a huge issue. When the Family Smoking Prevention and Tobacco Control Act was passed in 2009, flavorings in cigarettes were banned except for menthol. The theory was to protect our children because those flavorings were thought to attract children, but there was never any evidence that that was really a fact. Menthol flavorings, there are some studies that show that mentholated cigarettes do increase the initiation of smoking. There are other studies that contradict those. As a matter of fact, we have publications on that very subject, the mentholation of cigarettes. And it's pretty evenly balanced whether there is any attractiveness increase of menthol cigarettes for young people, or whether it makes people who smoke harder to quit menthols than regular cigarettes. What is not up for debate, in our opinion, is that banning menthol would amount to a detriment to public health, not a benefit. It's easy for people that are just reflexively opposed to anything relating to cigarettes, that if it's their response is, if it's bad for a tobacco company, it must be good for public health. And I understand where those emotions come from. But in the cold light of day, if you say, let's ban menthol because cigarette companies make menthol cigarettes and we don't like cigarette companies, you have to look upon the overall net effect. If a few menthol smokers will quit because of the lack of menthol cigarettes, that may well happen. Most menthol smokers will switch to regular cigarettes. That will happen too. But a whole lot of menthol smokers will continue to buy menthol cigarettes, but they'll buy them in the black market. And that would be a major detriment to public health. And I think the net effect will be a downer for public health. So I would be opposed to banning menthol.